Hi, I am Diamond Williams, and I will be talking about teen pregnancy, a sex education right. Teen pregnancy is the focus of a lot of public contention. In recent years, the sex education programs have become more common. There is also a drastic abatement in teen pregnancies, yet no one acknowledges it. Sex education is one of the most vital issues being debated. Some parents and educators disparage the use of sex education as a way to discourage teen pregnancy. They favor a curriculum known as abstinence only that advocates sexual abstinence as the only option without teaching anything about the use of condoms or birth control. Schools and communities are facing tough choices about the proper way to make teen pregnancy less common. Abstinence as the sole means of abating pregnancy is impractical, and it is reasonable to assert that sex education and contraceptives can proactively diminish the causes of teen pregnancy. In the U.S., every year approximately 1 million teenage girls become pregnant aged 15 to 19, though it has been declining steadily and significantly since 1990. According to the Alan Guttmacher Institute, a group that researched pregnancy and advocates for reproductive rights. In 2002, the rate of pregnancy was 7.54 for every 1,000 teens between the ages of 15 and 19, down from 116.9 in 1990. The decline in teen pregnancy has occurred in every U.S. state. Teens feel as though it's due to sex education programs that talk further about pregnancy prevention as well as abstinence. Talking to teens solely about abstinence does not decrease teen pregnancy. Abstinence only is an effective way to reduce pregnancy, yes, but it only conceals teens from the knowledge that he or she has all right of knowing. All teenagers want are options, and it is a parent's duty to be open-minded and equate their child with every option possible. Sex education in schools has decreased teen pregnancy rates, but there isn't any programs that can stop teens from getting pregnant or having sexual intercourse. Parents and students, educators and school boards are increasingly at odds over how and what should be taught in U.S. public schools. The results of teenage pregnancy affects not just the teenagers but the economy. It has been associated to a greater risk of health problems and poverty in both teenage parents and their children. Besides the detriment directly affected, teen pregnancy is also blamed for adding to the cost of health care because teenagers often require public assistance. Pregnancy is linked to a host of social problems and health risks. According to a Teenage Pregnancy and Parenting Project, also known as TAPP, teens who become mothers are more likely than a mother over the age of 20 to have health problems during pregnancy, and they are more likely to give birth to underweight or stillborn babies who are at risk for a variety of serious health problems. That is largely because teens are less likely to obtain parental care. This is why teens should learn about sex education, to caution them about what they are getting themselves into. Sex education program allows students to be aware of the negative impacts of teen pregnancy. It's not clear which is the best way, however, it is evident that all teens need the correct information. The big controversy is not whether or not sex education should be taught in schools, considering the fact that most parents and educators support the idea in some way. The real question is what sex education should include. A number of supporters of condom and sex education program believe that making teens aware of these things gives them a broad knowledge about sex, as well as giving them access to contraceptives in order to make responsible and safe decisions. Those who oppose the sex education and condom availability add that it teaches and encourages students to have sex. They also express that schools that introduce students to this program of how to use condoms and provide easy access to contraceptives are asking for trouble. Yet there is nothing providing that by making condoms and contraceptives available increases a teen's likelihood of having sex or becoming pregnant. Teen sexual activity and pregnancy rates have decreased since sex education has been introduced in schools. Teaching abstinence only doesn't recognize the reality of teenagers that have already had sex. Teens who have already had sex also need to learn about ways to prevent pregnancies from happening again. The average teen mother gets pregnant again within a year of having her first child. Most teenage parents report that they have never been involved in sex education programs. However, they were taught abstinence by parents and educators. But who does that help? Yes, the parent feels at ease because they think that their child is less likely to become a teen parent, but the teenager is not informed about how to prevent becoming a teenage parent. If he or she does not intend on having sexual intercourse. In fact, practically every person in the questionnaire said that they wished they had received information about how to prevent pregnancy or learn about some kind of contraceptive. Neither sex education program or abstinence-only program stop teenagers from having sexual intercourse, but a teen having learned about sex education previously does decrease their chances of becoming a teen parent.